Today, our main focus will be learning about the heart. The study of the heart, we normally call it heart anatomy or cardiovascular system. So, because I'm focusing on matriculant, I will call it heart anatomy. The best way to learn a heart anatomy is to draw it. Any organ that has to do with the human being, the best way to learn about it is to put it on a drawing. So, how can we draw a heart? Let's just simplify the structure of a heart. A heart will be something like this, right? And then we join it here right in the middle, but it should not touch each other. There is a reason for that also. This is a simplified diagram of a heart. I'm trying to give you a heart. Matriculant grade 11 learners, please pay close attention because this probably will come out. And then you put a layer here, but now you must pay attention now. This size and this size are not the same. It is not a mistake. It should be like that, right? This area, this particular area and this area, this is where we are going to be learning about anatomical biological terms so that we can understand most of the organ that exist within human being. Right. Now be precise. Look at this heart. When I come here, the angle will twist a little bit. I will tell you for what also, but try to learn the anatomical structure and the drawing of this heart first. You see, and then here it will be like this. Here there is no much effect like the other side. And then this area, this and this, we call them our ventricles. This one is a ventricle, this one is a ventricle. Let me just draw all of them. Now, what is the difference between these ventricles? There is no difference. It's only that this one it will be your right ventricle, this one it will be your left ventricle. Because remember, when you speak about the heart, you speak about someone's heart. When you teach about the heart, you are always focusing on a patient's heart or someone's heart. So this will be your left hand side, this will be your left, this will be your right. Just grab that concept. So this one is your left ventricle, this one is your right ventricle. Now, this is our ventricles, but is the heart complete like that? No, in fact, when it is like this, it does not make any sense. So what will be happening here is that we'll be having valves. Valves. This is what we do. There is no much different than mathematics. What you do on the left, you also do on the right. Look at this valve. Now, this valve and this valve are the same valve but have different duty and then drain to different places. So here we will have another valve facing up the way, facing up the way, facing up the way, and then facing up the way. Can you really see what is happening here? So this one gives rise to large arterial called aorta by itself. This is what it will do. If you want to agree with me, you will say I'm fine. Do you see that automatically there is another chamber of the heart here? But before we build up this chamber, what is happening on our left should also happen on our right. So let's have something that is like this again. This one is, these two are the arteries because in the heart we know anything that is taking the blood out of the heart, we call them arteries. Any blood vessel that is taking the blood towards the heart, we call them veins. In this case, do you see these ones, these arteries are taking? This one it will be our systemic circulation, this one it will be our pulmonary circulation. But first, let's label them accordingly. This is aorta. This is our aorta. This is our pulmonary artery. This one is our aorta. There is an R there. Artery, yes, it's artery also. Now we know we have our aorta. We know we have our pulmonary artery. So now, what are these chambers that has been built up by the rising of these two arteries? This will be like this. I want you to see. This is one, two, three, four. We have our four. This will be like this, and then this one will be like this. This is our veins, but when they're like this, they don't make that much sense. But I know how to join them. You will see they will make sense now. And then this one will overlap more than all of them. You see. So now I know also this one. We have our four main canal that has to do with distribution of blood there. Now also this side, we will have only two this side. Yeah, let's pay attention now. This and this is your ventricles. This chamber and this chamber is your atrium. Atrium. And then this one is also your atrium. These are the chambers that are draining your veins. These are your ventricles that will give blood towards the aorta. Now, do you see that we have our blood? We don't have our blood yet, but we have our heart. So here, let's come with something like this. This is our systemic circulation, meaning that this is all the organs of your body without the lungs. This is only the lungs. Now I want you to understand. all the organs of your body without the lungs. This is only your lungs. This pretty much explains the difference between the two arteries, blood vessels that are draining your ventricles, right? This is our systemic circulation. Now, the systemic circulation is divided into two components. We have our upper body, we have our lower body. But there are networks of capillaries that are carrying on here. But I just want to explain this one first. Upper and lower. Upper body and lower body. So this one, these are your veins, pulmonary veins. One, two, three, four. These are your pulmonary veins. We call them, these are your pulmonary veins. Right? Now, do you see that we understand this is our pulmonary circulation? I hope you can see this side. Pulmonary circulations. Pulmonary circulation, systemic circulation. This one we call it is a systemic circulation. So we do have our pulmonary veins, we have our pulmonary circulations, we have our systemic circulation, but we don't have our. So let me label this one first. This one, it will be superior. This one, it will be your inferior. This particular vein, this is inferior, this is superior, but when they are together like this, we call them vena cava. This is your vena cava, cranial nerve number 10, by the way. When we do nerve, we'll cover that one also. Now, understand that these two particular veins, they have their own duty, but they are taking the blood towards the heart. But what are they draining? They are draining the systemic circulation. So now we know here these now are your veins. Do you see? They will come up here again. Now I just need you to understand nothing much. So now pay close attention. This superior vena cava will come and drain the upper body. This particular inferior vena cava will come and drain the lower body. But all of them, they are going towards the right atrium. This one is an atrium. Now, the question is, what is pulmonary? Pulmonary is your lungs. Pulmonary artery is the blood vessel that will take the blood out of your ventricle towards the lung. The aortic artery is this blood vessels that will take the blood out of your ventricle towards the systemic circulation, towards the entire organs except the lungs. This will come into the nourishment of the whole organs without the lungs. This one is only going to your lungs. Now come back, let me explain something quickly. Do you see here? This particular area here is thicker than this one because the contraction that must take place this side, is going to nourish the systemic circulation, meaning that it must nourish from your head to your toe, meaning that the blood from your heart will be going far for nourishing systemic circulation. But this side, the myocardium contraction is a little bit thinner than this side because the lungs and the heart are not far apart from each other like this one that is nourishing the entire systemic circulation. That is why we don't need that much pressure to nourish the lungs because the lungs and the heart are very much interlinked and close to each other. But this particular one, the aorta artery, will go from your head to toe, and then think about your toe, think about the head, and then look at the distance of the heart inside your thoracic cavity. The question is now, what is this? This particular valve pointing down the vein. This particular valve, we call it is atrioventricular valve. But when we say like this, in case of injuries and diseases, we will not be able to heal you or to give you the cure, the medication. But when we specify which valve is it from left or right, we will know where is the problem. So in that case, we will have to name this one bicuspid valve. This is your bicuspid valve, or you can rather call it mitral valve. This is just a common name. Mitral valve. Atrioventricular valve, we call it is bicuspid valve. This at the end is your D. Bicuspid valve or mitral valve. Another one is this one. Now, what is this one? This one is your aortic valve. We know if we say aortic valve has a problem or has an issue, we can't come and check your pulmonary valve. We know where we're going. So the name of this valve, it will be this one is our aortic valve. Because of its shape, sometimes we call it semilunar valve. Now we come this side. What you do on the left, you also do on the right. You can't label this one, think that the names will be the same. This is not the eye. These are not the legs. These are different because they are doing the different job. All of them are pumping blood out, but differently towards different location. So what is this valve? The name of this valve, it will be, the name of this valve, it will be a pulmonary valve. Pulmonary valve. Now we understand. So what is the name of this valve that is giving difference between atrium and ventricle? We name this particular valve tricuspid valve. This is also atrioventricular valve, but specification, when we want to specify which valve, this one will be your tricuspid valve. I'm just trying to find a place where I can locate that. I hope you can still see. This is our tricuspid valve. This one. Do we have anything that we need about the... Here in pulmonary circulation, we just have the left and right lung. We don't have much to say about it. We just have the right and left lungs. The word lungs means pulmonary. So the nourishment of this particular pulmonary artery will come and help the lungs with blood and pick up oxygen also. So now the question is this heart complete like that? If you can take a closer look, you will see that we have labeled almost everything here. But I can tell you that this heart is far from being over. Let me get another color. You see this area? There are muscles. You know the story of anatomy. We start by giving you drawings. Later, we must color them to better our illustration because without coloring them, you will end up not seeing where we are. Even myself, I will not see where I am. Coloring is quite much better because I can't continue putting more layers while the heart is not colored. We should color the heart first and then I should put more layers because these layers are far from being complete. What is this colored area? This colored area is our myo means muscles. Cardiac means the heart. This is our this is our myocardium. This is where the heart contracts. Contraction is something like this. This is contraction. But it will start by pushing the heart to go up and then squeezing the heart so that the blood here can be able to be up there, to go up, to go to different places. We know we have our myocardium is responsible for making the heart to contract because this is where the electricity of the heart is attached to. But the origin of the electricity of the heart is coming from the right atrium, of which we call it the sinoatrial node. That is where the Purkinje fibers will come and get attached to myocardium, enable to allow the heart to contract. Contract is simply saying to pump the blood out of the heart or inside the heart. It differs because this area also contracts, but it contracts because it must inject the blood in ventricles. Ventricles, when ventricles contract, this one become incontractile, meaning that this one will not contract. And then ventricles will contract to inject the blood here. And then when atrium contract the blood into this valve, this one will not contract. This area, we call it is a ventricular atrioventricular valvular ring, that is electricity resistance, enabling the heart to contract only from the bottom chamber and the above chamber. This heart cannot contract all of it at once. That will be a disease. Let me give you, there is a layer again here. Hence, I said we should use different colors to try and teach about the heart. The heart you can't teach with one color. It's not possible. This is a simplified diagram of the heart. Learn with me. Surely you will pass. When it comes to life science, when it comes to organs, learn with me. The best way to learn this thing is to draw it, but another thing I can say, no substituting drawing your own, but rather draw one with me. I know what I'm saying. I've seen horrible anatomical structure that was given to me to allocate. My drawings are not perfect, but you can see what is happening. That is all that matters. What is the name of this layer that is inside? The name of this layer, we call it is endo endocardium is the name of this layer that is inside. What is the function of this layer? This layer makes sure that there is no blood clot remaining. It makes sure that the blood runs successfully smooth, and then all the blood can be contracted to go out to pick up oxygen again. We don't need thrombus here. We don't need thrombosis. Thrombus is a blood clot. We don't need those things here. Because of endocardium, this layer will make sure this layer is blood resistance. It cannot allow the blood to stick inside your ventricles or on top or somewhere attached to your atrium. The word endo means inside. Cardium means the heart. We know when we were doing the menstrual cycle, we have endometrium, the layer that is inside of the uterus. So in this case, we have endocardium, the layer that is endo means inside, cardium means the layer of the heart that is inside. This is the result of our endocardium. But again, we do have another layer. Excuse me. We do have another layer that is outside. If you start to study in January, when December time for final come, you don't have much pressure. You know, you can master the heart, you can do it perfect, you can master the eye, you can master the brain, you can master the abdominal structure, you can master the liver, you can master the skeleton. You don't have much to worry when final come. But when you want to do everything when final is here, you will see that school is a little bit difficult. What is the name of this layer that is outside? Do you see that we have a layer in blue? What is the name of the layer that is just after this myocardium? This layer, we call it is a peri pericardium. Peri means circle. Peri means perimeter. Now, what is the function of this layer? What is the function of this layer that is outside, surrounding a heart, giving a heart this circle? Remember, your heart is situated in a thoracic cavity where there are ribs. So this particular layer helps you when you move around because the heart by nature is shaking when you are moving, when you are joking, when you are exercising, and so forth. This lubricate the heart so that there shouldn't be friction. The heart shouldn't peel off. In a simplified term, I can say this: put the oil on the heart so that when the heart touches the thoracic cavity, it shouldn't peel off. This lubricate the heart. That is number one. Number two, this one helps the heart not to overexpand because the heart can grow, but it keeps the heart into its original shape so that it can work properly. When you exercise, when you are angry, when the heart beats so fast, the heart can grow. But pericardium will ensure that it sustains it to its normality. It is the work of pericardium. Now, blood will come now. Now I'm telling you about blood. Do you see that blood will come from our pulmonary veins? By nature, there are four. This is just a simplified diagram for everyone to understand the heart. Pulmonary will put oxygenated blood inside your atrium through the contraction of the myocardium. Contraction will take place and the blood will be injected through the bicuspid valve to your ventricles. Ventricles from your myocardium will also contract, squeezing the blood to go up to your aortic valve. Aortic valve will appreciate the blood, and then remember another thing is that here there are tendons. Here there are tendons. Let me put it in red. No, let me put it in red. These are muscles. In your knee, you also have the tendons that give the overall shape of the movement of your leg. This is your tendons. This is your papillary muscles. Papillary, papillary, papillary muscles. I want to explain what is the function of these papillary muscles. Do you see that these particular tendons attach to the both sides of the valve from each side of your heart? Now, these particular valves will get attached to the tendons, and then tendons will be pulling this valve to face downwards. But these particular papillary muscles are intrinsic into the heart to make sure that these tendons don't get tired of holding this valve. Why is that happening? This is happening to ensure one motion of the blood. This is happening so that only the blood should flow downward. Do you see? It's because of these tendons that are holding into the tricuspid valve and the bicuspid valve. This ensures that the blood can only flow one motion, only going down because of these particular muscles. These are intrinsic, meaning that are rooted into the heart. Muscles are holding the tendons, giving it the valve pressure to face only down. I think you have understood me then. This is your blood. Now, when the blood gets here, the blood will nourish the entire upper body here. And then the superior vena cava will come and drain this part. But the blood will still pass, and the blood will nourish this area, the lower part of the body. And then the inferior will come and nourish this, will come and drain this lower part, and the superior will come and drain the upper part of the body. Meaning that from your waist going up, we know that the blood vessels will be able to come and drain it. It will be the superior vena cava. The one that will drain from your toe to your waist, it will be inferior vena cava. So now the body, the circulation system is divided into two components. We have our upper body, we have our lower body. This particular upper body, what will come and drain it is this vein. What is the name of this vein? Superior vena cava will come and only drain from this one. And then the lower body from your waist going to your toe, it will be the inferior vena cava will come and drain this one also. Something that is interesting that is taking place here again is when you see, as this blood is nourishing the organs of your entire body without the lungs, it's losing some of its oxygen. Now I want to show you something. It's losing some of its oxygen, but no, not all its oxygen, but it's losing some of its oxygen. So the reason why we draw the blood that are coming from the systemic circulation in blue is to illustrate that this blood is not oxygenated now. This blood is going to look for oxygen. Remember, when we find oxygen, we find oxygen in our lungs. You breathe through your nostrils, the air will come and pass the areas, the throat, and through your respiratory canal. It will go to your area of alveoli, and the ex-hemoglobin will come and inject oxygen to be mixed with the blood. That is the entire reason why the blood is constantly going back to the heart, so that it can get a way to pick up oxygen in the lungs. How is that happening? Let me show you. The blood that is coming from your upper body will have less oxygen. The blood that is coming from your lower body will also have less oxygen. But when they are here, it will only be one blood vessel because this is a simplified diagram. You see, this is what is happening here. Remember this arrow simplify blood. There is networks of capillaries, meaning that many arteries, many veins will build up here. But the main reason why the blood is coming here is to pick up oxygen. So the blood will come here with less oxygen, but it will come out another side fully oxygenated. Red blood means fully oxygenated. Do you see the entire circulation? How does it work? It's not so difficult to understand this when you want to study. This is the best way to study. The blood come from your systemic circulation with less oxygen, and the reason why it's going back to your right ventricle and right atrium so that it can go back to the lungs to pick up oxygen. As soon as that happens, the blood will come out another side fully oxygenated. This is a continuous process. Excuse me. Let me just give you the pressures of this heart. This is 120 over 80 mmHg milliliters of mercury. Let me tell you something. This one, it will be around 14 over 20 milliliters of mercury. All the blood are milliliters of mercury. This entire circulation of this blood, you must know this today. A human being have 5 liters of blood. This blood that can carry a body of a human being is 5 liters of blood. This is what human beings have. Now, when this particular area, this one, do this, that is what we call as a contraction. When it squeezes the blood out of the ventricles towards your aorta, they will do this. And then this is 760 milliliters of mercury, meaning that this particular blood vessels can carry only 760 milliliters of mercury. But the pressure, the speed that the blood is traveling with, and the result from this contraction, meaning that after a heart has contracted like this particular blood vessel should open like this as a result of a contraction, as a result of blood coming out. You know, when this particular ventricle contract, this blood vessels will also open a little bit. When it opens, it will open up to 120 milliliters of mercury. And then the original, the normality, the normal size of this blood vessel is 80 milliliters of mercury. Let me show you. Contraction take place, and then the blood goes out of the uh, aortic valve, and then this particular aortic artery will open like this. That will be your 120. When it comes back to its elasticity, it will be 80. When contraction take place, it will be 120. When you have a high blood, that is when now it will be like this. It will pass this 120, meaning that there is a damage in your blood vessel. Something is not right here. Or when it goes to, when it's becoming narrow, it means also you are sick. We can have diseases such as venous thromboembolism, where we can experience a blood clot in one of your artery, resulting in peripheral edema. We can have cholesterol. We can have vasopulmonary vasoconstriction, where there is no, and then we can have also angina here when there is no enough level of oxygen going inside your lungs. You see, so there are so many issues that can result in giving the normalities of high blood pressure not being on under its normal size. When you pass this 120, you go to 150, you should be on medication because something is not right. When we do the CTG, EKG, we will show you that your heart means that if here is 150, your heart is doing this. Do you see that it is not enough time for this particular atrioventricular valvular ring, that is electricity resistance, to work? I mean, blood are not even touching the base of the apex of the ventricles. As soon as they get injected, the myocardium pump. This is what is happening even when you exercise. Now, when you have a low blood rate, when here, instead of having 120 milliliters of mercury, you have 90 milliliters of mercury. This is what is happening. This is low blood rate. High blood rate, this is what you should understand. Tachycardia, that is when now you must be checked to ensure that contraction of this happens. So we don't want any blood to be left here because any disease from your artery can affect your pulmonary. Any disease from your pulmonary artery can affect your aortic artery. Anything that is wrong here on your systemic circulation. Remember, how does the blood work? A blood and the heart work on this way. This particular 120 milliliters of mercury, the arteries themselves, they know the mils of blood that should go only in your brain. So if more blood are going to your brain, stroke can come. So this is auto-regulated. We know the blood that's supposed to go to your choroid inside your eye. We know the blood that should go inside your parietal lobe in your brain. So all this is auto-regulated. Ensure that you just take care of the heart. This will be a simplified labeling diagram of the heart. Next time I will be telling you about the electricity of the heart because the electricity just begin here. And then the networking of this electricity will come again here. This we call is SA node, sinoatrial node, giving this one electricity, overlapping also that side to come and help, giving attachment to this particular myocardium area. You see that's why I don't want to speak about the electricity of the heart. It will mess up the entire diagram of this blood because it's also red. So this one is your AV node. This is electricity of the heart now. When we think about the heart transplant, that is where we can see that the heart can beat on its own. It doesn't need your superior and inferior vena cava to receive life somewhere. When you remove the heart from a thoracic cavity, you put it on lab, it can beat on its own for decades. That simply tells that the electricity of the heart is intrinsic into the heart. So here it will be your atrioventricular node. It will pass that electricity of the heart down like this and go in this side. This one we call them Purkinje fibers. I will give you a clear diagram of electricity when I do the heart part 2. Thank you for watching. I hope everyone have understood.